you would not believe how much your dental health impacts your gut health and vice versa.
And actually 50% of your gut microbiome starts in the mouth because you swallow around about 140 billion bugs or microbes a day. So that's 50%. So if anything is already wrong in your mouth, meaning you have a dysbiosis there.
Hello, it is Healthy Gut Girl, Kitty Martone, and this is stuff your doctor should know. I'm coming to you live from deep inside your large intestine, and you would not believe how much your dental health impacts your gut health and vice versa. It is something that I think is really overlooked. I think when I ask clients, how's your dental health? They say, great. When you think dental health, you right away, you think cavities or, you think cavities, right? You think, I don't have any cavities, I'm doing good. I don't have any dental pain, I'm doing good. But it goes so much deeper than that. And today's guest, I have been following, kind of stalking on Instagram because it isn't just about going to see a dentist. It really isn't. The standard of care with dentistry is so low. And he explains it. I don't want to come down on dentists about this, but it's kind of like the difference between going and getting your car washed versus going and getting a checkup on your car, getting your filters checked, your spark plugs checked. Do cars have spark plugs anymore? To get your brakes checked, to get your oil checked. It's the difference. That's the difference. Like the standard of care of most dentistry out there is like you go in, you get your teeth cleaned. And if they see an obvious problem or if you have pain or something like that, then they'll do something. But my mentor, Dr. Marshall, and I talk about it a lot in this podcast, in this episode, talks a lot about dental health in the same way that this guest does today. This guest today, his name is Dr. Dominik Nischwitz, and he is he's a naturopath and a dentist, and he is a specialist in biological dentistry and ceramic implants, and the president of the International Society of Metal-Free Implantology. He's got this wellness center type of place, I'm assuming in Germany, that is pretty awesome. It's a holistic in every sense of the word. Like, it isn't just about your teeth, dental health is physical health. Dental health is gut health. And I love him for that. I think I'm very impressed with his work. And I was so excited that he said yes to my invitation. And he also wrote a book. And that book is called It's All in Your Mouth, Biological Dentistry and the Surprising Impact of Oral Health on Whole Body Wellness. And it's apparently a very easy read, very affordable. I highly recommend it. But first, we're going to listen to him, and he's going to teach us all about what he does and how important dental health is to your overall health in every possible way. Welcome to Dr. Nischwitz. So I just want to jump right in. Is that cool with you?
Yes.
Okay.
Totally.
So I wanted to first tell you that I had a mentor during my nutritional education who was Dr. Robert Marshall. And he was a pretty big pioneer, pretty good guy in terms of nutrition and muscle testing and quantum reflex analysis and all of this. And one of the things he would ask all of his patients in session immediately was about dental. It was the first thing he discussed. And I didn't know much about biological dentistry. But it honestly probably spent 35, 40 minutes with each client, just saying, because everyone would say, yeah, my dental health is good. And he would say, no, I want to talk about like your restorations, your crowns, your root canals. And they're like, oh yeah, I've got 3 root canals, and I actually have a cracked tooth back here, and this crown is 10 years old or whatever. And he would say, I would prefer that you spent your money on these restorations. Here are the dentists that I want you to see. and then come back to me and we'll get busy, because if unless they could do both, of course. But and I was moved by that so much, and also with a lot of dental issues myself as a young child, being put on a lot of antibiotics and tetracycline as a baby. So I had major dental stuff. So I vowed to always be obsessed with dental health and keep my teeth perfect and clean and all of it. And then I got into gut health. So I want to ask you, opening up here, can you explain first to my listeners what biological dentistry is and how it differs from traditional dentistry?
Of course. Thank you. So conventional dentistry is what you study in university, is basically just there to repair teeth. It's a high-tech craftsman skill that fixes bites and smiles and maybe aesthetics, yeah? Mainly pain, tooth decay, gingivitis, bleeding gums, oral hygiene. So it's really just mechanical work. Biological dentistry, or biodentistry 3.0, the way I define it is, of course, we need that high-tech dental work, but we fuse it with integrative medicine or functional medicine, as well as health optimization or biohacking, and to basically help patients heal overall by starting in the mouth. It's just, in my opinion, it's just the next level to the conventional stuff. For us, it's just standard to do the mechanical stuff perfectly, but obviously using materials that are not interfering with your own body.
Okay. And how, like with Dr. Marshall, he would muscle test certain, like he had a dentist he worked with that actually had different material test vials, and they would muscle test this on the body. Is that something similar, or do you have other ways of doing that?
I'm actually an ART practitioner, so Dr. Dietrich Klinghardt trained me back in the day. So I'm very good with muscle testing, but when it comes to the dental stuff, it's way easier. We just need basically a panoramic X-ray, a two-dimensional one. I can see straight away, are there any metals? Are there any root canals? Are there any jawbone inflammations called cavitations? Because those things will anyways come up testing if you look for optimizing overall health. So I call them the 3 health killers, because they go beyond just tooth decay, gingivitis, periodontitis. But your doctor knew, like, the dental restorations are oftentimes a hidden chronic trigger, and people don't know about it.
Yeah. So when someone goes, you're not negating the work of a conventional dentist. They're definitely useful, definitely helpful. But what would the average person do just to go in and say, well, yeah, I do have this old crown that always bothers me. Like, and the conventional dentist goes in, they clean your mouth, they do these things, and then you leave and you have the same issue. So looking for a bioidentical dentist, right? A biological dentist. That's not.
So biological dentist or holistic dentist, those are not trademarks. You cannot really patent it, or everyone basically could call themselves a biological dentist with a weekend course. So therefore, I've created a newer tribe, let's say, that I call the real biodentists, also known as the real bees, that do the complete thing. Because there are many people that call themselves holistic, but then they do a holistic root canal or test that various metals are still fine. But the stuff we're doing is very much science-based, but also includes every level of healing, physiologically, energetically, mentally, spiritually, all of it. Just like your doctor did it. Like, it's amazing. It's very rare, and it's one part of my mission is to teach all the health coaches, doctors, medical doctors, whatever, naturopath, that they have to do it the way you learned it, that oral health is one of the main pillars to overall health. But usually the mouth is kind of like outside body. And this is how we're trained as dentists. Just repair it. It's like a garage. And medical doctors won't look into the mouth. So it's really a separate entity. So biological dentistry basically means, what a surprise, that the mouth is part of the body. And in my opinion, it is the entrance to the body. It's the entrance to your gut system, which starts here and ends there.
Well, that you jumped ahead for me. I love the whole gut health aspect to it, because Kiran Krishnan, the microbiologist who I've had on my show a few times, talks about, low stomach acid and how everything that is in our mouth, and our mouth is a relatively filthy place and has a lot of microbes, a lot of potentially pathogenic microbes, and that we swallow those every day, all day. And if our stomach acid is not, robust and doing its job, that these pathogens can get right past the stomach and into, our small intestine and start to wreak havoc. How do you feel about that?
Yeah, totally. So basically your oral cavity is a huge ecosystem, has a big oral microbiome. So the gut microbiome is the largest maybe, but the mouth is the second largest one and the most diversified. And actually 50% of your gut microbiome starts in the mouth because you swallow around about 140 billion bugs, let's say bugs or microbes, a day. So that's 50%. So if anything is already wrong in your mouth, meaning you have a dysbiosis there, it's quite normal that you will have it just one station further down in the gut and then in the small intestine, SIBO or whatever. Like these bugs can travel various different routes. And there's even one step further. If you have bleeding gums, or the medical term would be gingivitis, we call it leaky gum. It's the same as leaky gut. You already have an opening straight into your system without even going into the gut system. This is how we find oral pathogens in your brain causing neuroinflammation, in your joints causing rheumatoid arthritis, in your synovial fluid, in your hips, like in your heart, everywhere. So, and even like the pandemic one, the virus, we knew that it was lurking in the mouth for 7 days and then activates. But if you have compromised mouth barrier, which is the gums, if it's open and bleeding all the time, these viruses would jump in way faster and causing all these cytokine storms. So now we know from studies, but we didn't know back then. So oral health is super important, and gums is like skin or like your gut mucosa. It needs to be very tight and close and never non-bleeding. And then it's a protective barrier. But for most people, unfortunately, it's the opposite. It's always bleeding.
Oh, that's so good. So you just made me think of something I saw during COVID. I can't remember where I saw it, where they saw a common denominator with a lot of people who ended up on respirators. They had a particular oral bacteria. I want to say started with a P.
Yes, it was Porphyronas gingivalis. It's one of the typical pathogens. This is also the one very strongly linked to rheumatoid arthritis and various other things. Also linked to I think the studies from 2023 where they found this specific germ in the brain of some patients causing microglia cells to get activated and causing neuroinflammation. So yes, your mouth can even make you anxious, can even make you depressed, can even make issues in your brain. Because it's the entrance of your body. It's like super simple. It's part of your body. This is what we need to get out there. It's a part of your body. It's not just there to repair. Like teeth are organs. These are teeny tiny organs directly connected to your brainstem with the trigeminal nerve. So it's basically an extension of your brain, like your nose and your eyes. And those are the organs directly like below your brain, directly connected to your thyroid, directly connected to everything.
Yeah.
The whole nervous system is kind of like transferred there.
I mean, it's just crazy because it's like you think of your first line of defense with your body is your stomach acid, your gut health, like your barriers, right? Your barriers would be like in the stomach or beginning as you eat your food and swallow, but it's not. That is just, it's profoundly amazing for people that have not heard this before. And, when I was studying with Dr. Marshall, this was 15 years ago, no one was talking about this. Nobody. And he only knew a couple of dentists in California that people would drive really far to go see because they were the only ones that knew how to do the rubber dam in California and do all these other things with metals, which brings me to that. Okay. Did you ever see The Beautiful Truth? The documentary. It was a Gerson therapy documentary. And it's quite old. They took a tooth that had an amalgam filling in it. And then they set up this light behind the screen, and they took
smoking tooth.
Yeah, yes. the pokey thing. And they scratched the top of the tooth and you could see the fumes coming off of the tooth. So
it's called a smoking tooth.
Smoking tooth.
It's because it looks like there's gas smoking out of it.
Yeah.
You can find it as smoking tooth on YouTube.
Incredible. Okay. So in that video, In that documentary, they said that 63% of people who have their amalgams removed will have an autoimmune condition within the first year if it's not done properly. Speak on that.
Yes. I don't know about the direct numbers, so there's no data for me to say it's 70%. But if you take out, let's say, amalgam fillings, which contain 50% mercury, in a non-safe way, let's say just in a conventional way, just drilling it out, you have an extreme exposure to mercury vapor, mercury particles, and you will get an immune response. There are many, many people that I have seen as patients, thousands, that have some sort of a chronic health issue afterwards. Oftentimes it's actually autoimmune, for example, multiple sclerosis. I wouldn't say it's the main cause or something, but it's a super strong correlation with these metals and this high trigger. So oftentimes they were quite okay, or they had maybe some little chronic stuff, but then afterwards it's really got enhanced, and it makes perfect sense. This is why we also, every biodentist would remove all metals, not just the mercury ones, every single metal under a lot of safe removal techniques. It's not just a rubber dam. There's way more to it to minimize the exposure to any sort of metal. Obviously, mercury is super toxic, like very toxic to the body, but all the other metals are immune triggers too. So we always have to decide or like distinguish between, is it just a toxin, which maybe puts a burden on your liver and detoxification system, or is it also an immune trigger? And mercury vapor, for example, can be both. So you can become allergic to it. So that would be really bad, because then you're having a detox issue and being allergic, and this oftentimes helps promote autoimmunity. Autoimmunity, you can also see, like, your body's not stupid. It doesn't attack itself for no reason. So for example, when we go to that mercury example, what we could find if you do ELISA tests with these autoimmune patients, what oftentimes happens is that we, for example, find no allergy or nothing against mercury, but for example, against myelin mercury, meaning, or cadmium myelin. Myelin is the nerve cells around, like the insulation of the nerve. So the body then sees this cell as a wrong cell, because there's basically just a normal myelin cell, but there's a mercury attached to it, or there's a cadmium attached to it, or lead attached to it. So then it's a wrong cell, and this is what your innate immunity does. It just attacks wrong cells and builds autoimmunity against it. So we have to find what is causing these triggers. And therefore, it's very, very important, not just therefore, but also to remove these metals super safe. Like, so that you don't expose yourself more than you have. But because you're wearing these like for 10 years, 20 years, 30 years, you're already exposing yourself chronically to mercury fumes on a daily basis, but not as high as when you just drill it out. So therefore, don't just freak out and go take out these mercury fillings. Find someone who knows how to do that perfectly. In the US, there's the IAOMT that certifies dentists for that mercury removal. It's called SMART, like smart, safe mercury amalgam removal technique. They're not necessarily real biodentists, but at least they will know how to remove mercury safely so that you don't get any immune issues or detoxification problems because of the high exposure.
It's also an issue for the dentist, is it not? And the hygienist and whoever's helping him?
Like, of course, imagine if one drill out could provoke an autoimmune process with a patient. Imagine a dentist does drilling out maybe 5 times a day, 10 years, 20 years, 30 years, not protecting himself or his nurses. And there's great studies showing that the pituitary gland of dentists is oftentimes full of mercury, and obviously rendering the complete hormonal axis and everything off. And you also know maybe that there is the Mad Hatter's disease. So Mad Hatters were these guys in England that were working on sealing the heads, or building heads and then sealing them by using mercury. And they all got crazy. It's a disease in medical terms. You can look it up. Mad Hatter's disease. How often do you think this happens to conventional dentists? I think it's a lot of times. Also, studies shows that dentists are usually at the forefront of committing suicide somewhat in their day. Like, the highest risk for suicide is usually dentists and pilots and psychologists, and obviously nurses, dental nurses. And this is not just because of the toxins we're working with. It's also obviously because of dentists having a bad rep. Patients don't want to see them. They come in with fear. So, and we're way too close to the patient. So not arm's length, but basically holding them here. So it's more than just toxins, but toxins play a big role. And we know, there's all the studies there. We know that these mercury vapors, for example, they just go through the cell into the nucleus. And the only chance your system has is to die off the cell, which happens after, I don't know how many days, depending on the cell. Some even last for like a couple of months. And as soon as you have that mercury in your system, and you have that within 24 hours after having a filling, the mercury gets oxidized through catalysis and stays in your tissue 16 to 32 years half-life. So it's almost impossible to get it out. So you have to really then, after removing the source, which obviously the main source for mercury toxicity, this is very important. The main source for mercury toxicity is not the fish you're eating. It's still the mercury filling that gases out on a daily basis. Yeah, for 10 years, 20 years, 30 years. So remove the source first before you then start detoxing. And I see that oftentimes that integrative medical doctors, I mean, they want to do a good job, but they start chelating patients and they have the mouth full of metals. That's just havoc. That's creating chaos. That creates autoimmunity oftentimes. So you have to be really precise and careful when you start instigating something like a chelation therapy. Yeah, the mouth needs to be completely clean. Otherwise, you just redistribute and maybe block the system even more.
Wow. Yeah, that makes sense because so many people, like, that number that they said 63% of people, I would imagine it's people that already have a high toxic burden. So those are the people that probably have the most difficulty clearing metals naturally anyway. And then they go in and they're panicking. I see this all the time. People will send me messages and say, I have all these things going on. Should I start with getting my metals out? And it's like they have all these other things that, they're physically dealing with and their toxic burden is so high. And it's like, so that's a question. If a filling is stable, like if you've had an amalgam, so I've had dentists say this to my husband and in the past to clients, the dentist will say, don't touch it. It's stable. Like it's fine.
No, that's not correct.
Okay.
That is not correct. No. Just by eating and drinking, chewing foods, eating or drinking acidic stuff, going to the dental hygienist, brushing your teeth, there will be a certain amount of mercury vapor. You don't smell it, you don't see it coming out. It's around about 2 to 3 micron per day. It's like a millionth of a gram. Like it's tiny amounts. But this is cumulative.
Right.
That means you have that for 10 years, 20 years, 30 years. That stuff holds forever. That's why insurances still pay for it. But from 2025 onwards, it's finally forbidden in Europe, so we can't use it anymore. They don't tell you that it was just a bad idea to do it. They blame it on the dentist now, that it's now going to be more expensive at the dentist. But at least they will never admit that this is not a good idea. But at least they finally ban it. So that's a good thing. So there will be a need for all you dentists out there to become a real biodentist, to learn all these things, because patients will ask for it, because it's not allowed anymore. And I think in the US, it will just follow maybe like 1-2 years later. I don't think they can hold it up longer. And then we need alternatives, and we should never just drill it out. That's the main thing. Okay. Remove the source safely first, but also, like you just mentioned, the patients that have so there are a lot of patients that are super fine with it. They have amazing detoxification system, no worries at all. But the patients we're talking about having chronic health issues usually can't methylate very well, usually have a couple of other SNPs, can't produce glutathione. So they are genetically speaking, in a not ideal world. So they need to have genetic bypass. So before we even start to do anything, we would do the same way as you do. We change the nutrition, we change the diet, we fill up the micronutrients, we cover the methylation, we cover cryptopyruria, we cover all these things before they come in and we take it out. So we always prepare our patients at least probably an average 4 weeks prior to the health optimization week. That's why most patients actually fly into us from all over the world, because we do it all in 1 week. Take out all the metals safely. We take out all the root canals and place ceramic implants, which basically no one worldwide does, because only 0.3% of all dentists worldwide know about ceramic implants. That's one thing. And also we take care of the cavitations that we haven't touched yet on chronic jawbone inflammations, and do this in a setting where we have, this is the clinic over there, and I'm in the separate building where we have health optimization, hyperbaric, intravenous, hypoxia training, everything you can imagine to just help patients heal faster.
Beautiful. It looks really pretty there, by the way. It's almost like a painting.
It looks like a painting, but it's really just the outside.
Yeah,
this
is real. This is my backyard. Okay, so something Dr. Marshall used to say was about, like, if you have a gold crown and a silver crown, and something about a battery and how it chelates metals faster into the bloodstream and mucosa than is that true?
So what happens is super simple. Basically, in your mouth, you have the saliva. The saliva is a strong electrolyte. So imagine it's kind of like salt water in the sea. So imagine you have a propeller of a boat underneath the water. What happens over time? It gets rusty, right? Everyone knows it rusts. So metal ions will always dissolve in a electrolyte, which is the mouth, it's the saliva. So these ions from gold or whatever, or palladium, or all the other things we're using as dentists, they just leach out of that, let's say the cap or whatever, or the filling, and go into your saliva. If you have various different materials, like you just said, that have a little bit of a different, I don't know the word in English, let's say just gold and silver next to it, or mercury and silver next to it, or mercury and gold. So there will be the electrons now will go from the anode to the cathode and producing something called galvanic element, which is a battery. So that's the other thing. Stuff dissolves just because it's a saliva is an electrolyte, but also because it's an electrolyte, this is how a battery works. Different materials with different currents, that's what I was missing, build the galvanic element. So it's really a battery. So this will then obviously go into your system and can trigger your immune system, but again, also puts another toxic burden on your system. And there is tests you can do, like lymphocyte transformation tests, to really see if your body has built an immune, like really the metal can become an antigen and your body builds antibodies against it. That's possible. And therefore, every single metal nowadays needs to be basically seen very critically. So we don't do any metals. We remove all of them, even titanium implants, no metal allowed, because even if you're not having an immune, so challenges for metals is immune system can become allergic or autoimmune. Then the toxicity, mercury, for example. And the third component is we're living in a world of 3G, 4G, 5G, EMFs everywhere. So any single metal in your mouth, 2024, can be a micro antenna, even the mercury in your system. So therefore, you can't really tolerate metals anymore. It's different 30 years ago in the 90s, but now we're not in the 90s. We are in the 2020s. So super, super important that you understand all these three health challenges when it comes to metals.
Amazing. Okay, so now that brings us to materials. So if you have a filling and then you go and you get the porcelains or whatever, what's up with BPA in those other fillings, BPAs?
Yeah, so basically what we did back in the day, we tested all materials, muscle testing and immunologically, to see which ones are the best. And obviously you can find composites, that's what you're talking about, composites without BPA. That's not a problem at all. Okay. But it's always plastics. So there are maybe some things that might be a little bit disruptive. However, if you work on modulating your immune system and cleaning out all the toxins and helping the body to prepare and build, the goal is that your immune system will be tolerable to a little bit of composites, which we anyways harden through UV light, and there is no more lots of triggering. I would still test it and see which one is the good one and use as little as possible. So for tiny fillings, composites are fine. For bigger ones, let's say half the tooth is destroyed, we would use a ceramic piece, let's say a partial crown or an inlay, and then just use the adhesive in a very thin layer, which is then the plastic, so to speak. So reduce that amount just to make sure that we don't have a problem. But from a toxicity level, I would say, or immune level, there's 100-fold more risk to everything when you do the metals, especially the mercury. So I would always go the composite route. Ideally, obviously, my goal is to help patients never see a dentist in their whole life, but that starts very early. Yeah. So for most patients right now, this train has no, this ship has sailed.
Yeah.
And we have to find solutions to repair as biocompatible or with as many biomaterials as possible. And that's possible. We can do everything completely metal-free, even the implant. That's my specialty personally.
Amazing. I didn't know there was a completely, well, you said ceramics. I mean, yeah.
So if you have lost a tooth, so the normal dental career is you have a tooth decay, then you get a filling, then it's getting bigger, then you need a root canal because you have pain, then the tooth gets a cyst, you need to remove it, then you have a tooth loss, and then we need to give you an option to buy it. So the implant is basically a new root that is inserted into your bone, and 99% of all dentists use titanium. It's just a gold standard. There's nothing really bad about it. It's just in this world, it doesn't really cut it anymore. You need to have different solutions. So for more than a decade, I'm one of the first ceramic implant specialists, meaning I use not a titanium implant, but a ceramic one, which is just basically the same thing, but white and completely neutral to the body. It is actually medically qualified since 2023 as a true biomaterial and is medical guideline now. So now dentists need to at least inform their patients that there's two options, titanium and ceramic. And 5 years ago, I was only like, you cannot imagine how many shitstorms I already had bringing out my book and talking about these things, because I was quite young at that time, because I started to teach when I was 30 years old and always wanted to change everything. Now I get it, but now luckily it changes because of aesthetics. Because if you give a patient the option, choose a gray screw in your jawbone or choose a white one, no patient will ever choose a gray one unless you want to be Terminator or have some sort of a metal thing going on. But usually you would decide, oh, I want to have the white one, because that is how your tooth looks like. It's just more aesthetic. So therefore, all the big companies bring out a ceramic implant, not for biological reasons, but secondarily, they will learn that is the better option anyways. It's called zirconia or zirconium dioxide. It's a ceramic, completely white, completely neutral.
And cost for the difference between the titanium and the ceramic.
So just the material cost is a little bit more expensive for the ceramic, obviously, because it's just the quantities they're making it right now, because it's so little. It's just a matter of mass production. I think over time, if more and more people use it, it will be cheaper. But here comes the kicker. So usually, if you lose a tooth, you lose that tooth, then you have a gap. After 3 to 4 months, you will see the dentist again, and he will do a 3-dimensional x-ray if he's a surgeon and see if the bone is good or not. Oftentimes, because that's just normal, the bone did collapse and you lost bone height. So that means you might need to have a bone graft. Then you're looking into another surgery and another 6-month waiting time, another 2 to 3 times traveling to your dentist, and then finally placing the titanium implant, waiting another 3 months until you get your crown. So that maybe is 12 to 18 months time. Wow. And 6 to 10 appointments. So that costs a lot of money. Just honorary fees and stuff, and time off your work maybe. So what we do is we take out that root canal and immediately clean the socket with ozone, using PRP, everything, and put that ceramic implant straight into the socket to stabilize it. We have shown in studies that this will stabilize bone height and width. So it's the best strategy, because at that point, your body anyways wants to heal. And it's not really a surgery. We just took out the tooth. And then the next appointment, usually 3 to 4 months later, is, oh, it's stable. We do a prep, make an impression, and then crown. So it's 3 appointments in 4 months or 6 months maybe, versus 12 to 18 months, 6 to 10 appointments. Wow. So it's actually cheaper.
Nice. Yeah. Let's see. I got sidetracked because I was thinking I had this surgery once, going back to the beginning of our conversation, actually. I had this surgery on my foot, and like 2 days before, I was having some pain in my wisdom tooth, and I went to the dentist and they said, oh, we got to take your wisdom tooth out. So they took my wisdom tooth out, which was the most beautiful wisdom tooth. I was like, why did I have to get that taken out? It was perfect. It's a pretty... But he's like, it's slightly impacted and it's causing you pain. So he pulls it out, and then, I was fine. I went on with my business. And then a couple days later, I went to get this surgery, and the doctor came in to do like a checkup real quick before. They had already given me a shot to like relax me for the surgery. And he goes in with his light to look in my mouth, and he goes, "Wait a minute, what's going on back there?" I said, "Oh, I had my wisdom tooth removed." And he's like, "We can't do the surgery." I'm like, "Why?" He said, "You didn't tell me that. And that's terrible. You could get infected." I'm like, "On my foot?" He's like, "Yeah." So can you explain what happened there?
Yeah, so yeah, if you have any like this is maybe an acute inflammation that happens after taking out your wisdom tooth. And if that doesn't properly heal or is too close to it, bacteria can obviously, like I talked before, can obviously jump into the system. Like the next station is usually the heart, but it can go as far as your joints, even down to the foot, because bacteria from the mouth, if they reach the bloodstream through, for example, that open wound here, within 60 seconds, they're in your whole body. Obviously, it's a very strong precaution he took there, but I can see why.
Because it could have gotten infected. The surgery site could have gotten infected.
Yeah. It can infect, or just your overall body can become more inflamed because it doesn't heal properly here. So
liability.
What a bummer if you're already like sedated and stuff, and then they're like calling off the surgery.
I was calling my friend to come and pick me up. I'm like, I can't believe it. So yeah, we had to schedule like, I don't know, a week later or something like that. So, okay. So these are just some really very basic questions, but I feel like my listeners will appreciate. How does nutrition play a role in biological dentistry?
So nutrition in the teaching I do plays an immense role. For me, this is the foundation of all healing. This is one thing I teach in the whole conventional dentistry, is how to support the body before and after surgery to make sure that it's systemically healing. Because we usually, as dentists, we only see everything locally. Oral surgeon, they will give you the consent of, oh, you need to take your ibuprofen, your painkillers, you apply the cold, and you will be swollen. But they never check anything related to macro or micronutrients. So I've developed a concept called the food design concept that I'm teaching to dentists in the online certification now, which is basically, I would say it's an umbrella above all nutritional mindsets. So there's so many patients coming in with so many different diets. The one wants to be a vegan, the other one wants to be a carnivore, the third one wants to do intermittent fasting, and paleo, you know how many, or low carb, high carb, you know, all these things. So over time, I realized, okay, I don't want to change their mindset. I want to be as quick as possible to tell them how to optimize their nutritional lifestyle in order to make them anabolic. So the food design is basically just learn how to think in nutrients. It's based on eating real foods. It's based on step 1, avoiding stuff that is pro-inflammatory, sugar, gluten-containing grains, conventional dairy, and refined vegetable oils. This is a red chart, and then we have alternatives. And the green chart is basically protein, healthy fats, healthy carbs, fruit, vegetables. And I can, within 5 minutes, I can design a complete nutritional protocol that supports bone healing, tissue healing, gut healing, overall health. And this is the nutritional bit. So very, very strong focus on it, because I'm not there to do a surgery just to do a surgery. I want to help your body heal. And if your body is in hibernation mode because it's depleted, because you're eating a standard Western diet, it's not a good place to do a surgery. You need to be prepared. But also, besides all the macronutrients, the most critical one is protein. We can touch that later, everyone. We also look into micronutrients. And that's what the other thing I'm teaching is the bone healing protocol. Basically, which micronutrients do we need to support proper bone healing, and actually tooth healing is the same. And there's strong science behind it. It's all functional medicine, basically. The bone healing protocol was initially designed on high doses of vitamin D3, like 20,000 IUs a day, including all the cofactors. But it eventually, let's say, developed into a full body optimization protocol over the years, because that's what it is. And it's super streamlined, because I don't have a lot of time to explain this. People should invest time up front to read everything and learn and do. And then I just individualize it and put a little bit of a focus on it, and let's say accountability, because I'm speaking to them and they're having a surgery. They're incentivized to change their lifestyle. And if they do that now for 3 months completely strict, while they're healing everything, they also, as a side note, heal their complete gut system by starting in the mouth, as well as probably because of it, losing tons of body fat, because the body is just getting healthier and they are allowed to eat a lot, just the right things. They actually need to eat a lot, especially protein, because we need that for healing and recovery. It's like bodybuilding. You need protein.
Yeah.
And yeah, that's a super, super, super important thing and one of my biggest teachings.
Nice.
In the whole dental game.
Yeah, speak a little bit more on the protein. Like, I'm definitely, a lot of what you do sounds like the world that I kind of come from and that I've been working in for a while here,
Yes.
which is the pro-metabolic lifestyle choices, very Dr. Ray Peat-esque, you know, just complete macros, balanced macros for your individual needs. Yeah, talk about the protein a little bit.
So yeah, basically protein is the building block of life. And most people only think protein is needed to build muscle. That's not correct. 50% is already gone for your immune system. We need that to have a strong immune response. We need that to build all these cells. Then we need it to digest. All the enzymes are protein-based, amino acids basically. Amino acids are the tiny parts of proteins. And then the rest that is left over maybe is getting used to build muscle. But that's the least important, unfortunately, for your body. So therefore, when it comes to healing, obviously, it's like building a house. We want to have a surplus of the right nutrients. And first of all, protein is not a percentage of your macronutrients. It's a fixed number. I just give patients 2 grams per kilogram, ideal body weight. It's roughly equals a gram per pound ideal body weight in your terms. So meaning if you're 50 kilogram woman or 100 pound woman, then you eat about 100 grams of protein a day, which is not a lot. And I also put people off fasting for that period because I want them to be feeding themselves all the time, kind of like a little baby, to just be anabolic. And don't cause any stress by fasting because that's basically what it does. We don't want to push adrenal glands even harder because a lot of these people that I see chronically unhealthy are already having a hard burden on their adrenals. So pushing it even further is not the best strategy.
Nice.
So protein, key nutrient. And I'm a fan of eating real food. So if you're not a vegan, then I would recommend you to eat good quality meats and fish and eggs, like we did the last 2 million years probably ever since. But I understand if you're vegan, there's other ways around it. It's possible. I will just let you know what kind of stuff to use. Maybe you have to use a little bit more essential amino acids extra, a little bit more protein powders, because we know that we need about 20% more protein if it's plant-based. But also, I have to take into consideration what is your body composition. So we always scan body composition up front. It's not a DEXA scan. We use an in-body scan, but the medical one, it's 96% the same as a DEXA, but without the bone density. And I can see on that paper, oh, wow, you're under-muscled, or you're just too fat, or you're skinny fat. And this gives me another incentive to tell patients why they have to do it besides surgery. So we did a survey for patients the last 5 years. Usually they stick to it. They understand it's a lifestyle. Yeah. And obviously if they're once healed and everything is fine, they can maybe revert back to 80-20. So eating 20% of the time they can eat whatever, if they're not allergic to it. But 80% needs to be from solid foods. And it's so simple. Just eat real food. That's it. Yeah. Like stuff that you can hunt, fish, gather, all these things.
Yeah, it's so good to hear you talk like this because I think it's a movement, a new movement that's gaining some traction, because I think a lot of the people that are coming to you with a lot of major dental issues, it's not just about the mouth, of course, it is about the way they've been feeding themselves, and it is about their gut health, and how maybe they've been under eating, or like I always say, I used to be a chronic under eater, and it's just, you know, you think you're eating healthy. I thought, okay, well, I'm eating salads and all this raw food and just under eating. And some people who actually overeat calories, but under eat protein and under eat even healthy carbohydrates because everyone's afraid of carbs. And so it's just, right?
Yeah, I know. People are always afraid of any sort of the energy nutrients. Some are afraid of carbs, some are still afraid of fats. Yeah. That's why in the green chart we're using in the food design concept, there's a chart called healthy carbs and healthy fats, because there's both there. Yeah. Obviously, for some people, we have to reduce carbs a bit because their metabolic flexibility isn't there. You have to train that first.
Yeah.
and get them insulin sensitive back. But then I'm a big fan of carbs, and especially also for women, they just need a little bit of that just for your hormones. We need a little bit of insulin. We need the thyroid to work. We need the sexual hormones to work. We need carbs. I don't say we need sugar and refined flour, but maybe you need a sweet potato from here and there, or maybe some berries.
Yeah.
Just not huge amounts, not like 300 grams that the average American eats. That's too much for most people.
Yeah.
And on average, that's crazy, actually. I do a lot of sport, and on average, I don't eat 300 grams of carbs. I just don't need it. I can do easily 600, but I don't need it. So it's more about balancing out. And I'm also like level 3 of that food design concept would be taking health optimization or like tracking devices into account. People who are wearing like Aura rings or Whoop straps and all these things. So if I have and a lot of patients actually are not only chronically unhealthy anymore that come to see us, we have a lot of people that look for optimal health, like high performer athletes, actors, all people that, or me personally, people that just want to have the extra edge.
Yeah.
And if they have like a ring or have a nighttime HRV measurement, I can roughly see if they're sympathetic dominant from nature, or let's say balanced body types, or more parasympathetic dominant, and then adjust energy nutrients according to it. So super simple example, if your HRV nighttime is on average 20 to 40, for whatever reason, usually some sort of genetic, then you're more sympathetic dominant, then I would give you lots of carbs usually, because you just need them as your yin. Versus if you wake up and have a nighttime average of HRV 120 to 200, you're probably parasympathetic dominant, and you probably will be tired if you eat carbs in the morning. So you might be better eating paleo and eating more fats. And then there's people like in between, more metabolic balanced types, they can do both. And they have an HRV, let's say roughly from 50 to 80. And this is one thing that I criticize about the biohacking world, because they always say higher is better. It's just completely wrong.
Right.
And also these rings are about 50% accurate. They just give a trend. This is not HRV that we use here in medical terms. We can measure HRV too, but what we want to have is see how resilient your body is. So we can measure the HRV in real time while you're on the surgery. I take out the root canals, or one of our surgeons takes out the root canals or the cavitations, and you see instantly on that monitor how you transfer from sympathetic to parasympathetic.
What?
People start to cry during this, and it's amazing. But it's a little bit next level, obviously. I'm not working only with me as a person. I work with thousands of patients for more than 15 years now. So that's just more, it's not N equals 1, it's N equals thousands. So it's more frontline work. But that's the goal. I want to help as many people as possible to understand that optimal health starts in the mouth. That's why we do these podcasts. That's why I try to just spread the message, basically. That's the main goal. Change the way how dentistry and medicine is done completely, to actually finally help patients get healed overall and get super healthy. Because in nature, we wouldn't need a dentist. Like, we have perfect hard teeth, we have space for everything, but we have to just teach that way again.
Yeah.
And live more ancestrally.
We like to have people test their basal body temp in the morning, and
it's great.
And just to see, how often, how frequently there's like subclinical hypothyroid, which is, like telling us, well, you definitely are in your sympathetic nervous system. It's so helpful that you also said that you would likely give that person more healthy carbs. That is so key. That's going to be a huge clip, I can tell you right now, from this that I'm going to share everywhere.
Yeah, I would give them healthy carbs, but the problem here is these people oftentimes, because of being in a sympathetic state for ages, are also oftentimes overtraining, also liking the adrenaline rush, therefore doing intermittent fasting and keto diets, because that makes them even more sympathetic. So they build their let's say pathological thing even further towards the wrong side. Yeah. So the only thing I'm teaching is not about killing anything or nuking anything or going extreme on one end. It's all about balancing it. We need to be resilient and be able to do both at the same time. Like, not just push. And I can tell from experience, I was that guy myself, always pushing and everything, but realized, oh wow, I'm actually a balanced body type, so I have to do it completely different. And go back to more individual eating and all these things. But you have to give patients a little bit of rules to follow until they finally get their instincts back.
Yeah.
Like animals have instinctive eating. So just one of my doctors told me today, it's a very cool story. She has lots of cats. She's a cat woman. And her cats decide if the food is good or not, because even if it's just good meat, they smell, if it's from the wrong store, maybe supermarket, they won't touch it. They rather starve until and not eat it. Versus we would definitely just eat it because it's meat. And they know exactly. So she has her like indicator, being a cat or one of the cats, to know, oh no, that wasn't a good idea to buy that meat. So that's how we should do it. So instinctive eating basically means we walk around in nature, we see something that we like to eat, then usually we use our senses. Smell, so first is seeing, oh wow, that's nice. Then smelling, tastes good or smells good, okay. And then last one is take a bite. And if it then is not good, you will spit it out. Let's say a nice mushroom. But now we have hyperpalatable foods, and the complete chemistry tricked our bodies. So we will eat every single shit out there that is completely chemical. It tastes amazing. That's how I train my kids always. Like, you could even paint like really dirt, paint it and make it nice into foil and put some chemicals to it, and you will eat it and love it because it's amazing. But it's just crap. It's just literally crap and crap food. And I know we all love convenience and like to eat a lot of bars and stuff. But a protein bar is not better than a Snickers usually.
Right.
Right.
So you answered all my questions that I had for you, just in terms of like, what your plans to kind of, what are your goals for coming? You're coming to LA and your speaking engagements in the US and the US media, but you kind of answered that. But you're welcome to delve more into that if you'd like. I know you have a book, right?
Yeah. I have a book. I wrote a book called. It came out in the US in 2020, in Germany in 2019. It's called "It's All in Your Mouth." That's basically not a medical textbook. It's written for the layman. It's more like I don't know how you call something like this. It's more like a thriller, but from a health point of view. So it's actually written so that my mom will find it interesting, and you don't need any information before upfront. It teaches the complete concept in a simplistic way, and it's easy to read. It's fun read.
Okay.
So it's all in your mouth. And yes, I'm going to Los Angeles area or California now in August, like 1 month from now, to have a couple of in-person podcasts like Max Nugewer and Stephen Gundry and a couple of other ones, just to get that message out. It's not about me. I just want to help as many as possible. And therefore, it's good if there are people that's spreading the word.
Yeah.
And therefore, I invest that time.
Yeah. I'm normally in Los Angeles. And so...
You live there?
I do, yeah. But I'm in Florida now. We're kind of back and forth, but I'm normally in Los Angeles. But I have a estrogen dominance support group on Facebook, which has, I think, like 47,000 members right now that are all pretty active women. And, we talk about... We can touch on
hormones in your mouth if you want to.
Yeah, for sure. That brings me to this, which I was going to say, our thyroid sits so close to our mouth. And if you have low-grade infection, you have like leaking teeth, leaky gums, this can also go, and it's such a spongy little gland, isn't it? Like, couldn't it just, is that possible that it could actually be affected by this low grade, bacterial load?
Yes, it says 100%. The thyroid is kind of like the thermostat for every single stressor in your body, from the diet to root canals, chronic infections, toxins. That's just how it goes. Because if you're in your brain, if your hypothalamus pituitary axis senses stress, they will produce cortisol, and this molecule, CRH, will just already block the thyroid from its working. So that's how closely related it is. But on the other hand, obviously these toxins can just leach there, attach itself to thyroid cells and block the receptor, for example. So thyroid hormones doesn't work. So you would look into RT3, reverse T3. That's high. It's usually a sign of stress, but usually also a sign of high toxicity. So the thyroid is definitely affected. But also another interesting thing is it's like every single tooth is connected to an organ. That is not medical standard conventional medicine. That is Chinese medicine and autonomic nervous system. So there's a chart for it. You can find it in my book, but also you see it in my Instagram all the time.
Yeah.
You can see it on Instagram, yeah.
Mm-hmm.
And in the lower jaw, your premolars, those are the ones behind the canine, and the upper jaw, the molars, are directly connected to your thyroid. They are on the so-called stomach meridian, which is the thyroid and your what is that? The breast and your uterus, all the female parts. So there's a study showing from Thomas Rau from Paracelsus Clinic in Switzerland, who found that 94% of all his breast cancer patients had a tooth on that adjacent meridian. It's not a causation again. It's correlation, but 94% and the healthy ones only 30%. I think it's a strong correlation.
Yeah.
And again, it's cytokines, it's toxins, it's chronic infections, is multitude of things that you have to understand that a normal dentist doesn't understand. They are only there to help you against that pain. Therefore, root canal is completely fine because in their world, you can bite on it. Of course you can, but it's not super healthy for the overall body.
Yeah. You know, I'm just now coming into menopause, yay me. And like I mentioned in the beginning, I've just been obsessed with my teeth. I just take such good care of them my whole life as an adult, basically. And I went in to see the dentist because I noticed that I had it looked like I had cavities on the back, on the bottom underside back of my teeth. And I was like, what the heck is this? I was paranoid. I was almost crying because I couldn't believe that gotten away with me, that I didn't see that. Yeah. So I went into the dentist and I told her, I think because I'm in menopause, I'm having some bone loss. And so I'm getting plaque and I'm starting to have some issues. And she just interrupted me and said, no, absolutely not. That's not possible. That's not, you just have plaque. And she did a really good cleaning. And I said, well, is there any cavities? And she said, well, no, but it could get that way. So you have to just take good care. I was like, okay, thanks. But I mean, isn't that true? Menopause, bone loss, isn't that totally possible?
Yes. So there's different things. So menopause, obviously, your hormones change a little bit, and we need hormones also. As you know, if you have too little estrogen, it's always connected to bone loss or osteoporosis. That's one thing. But also, funny enough, have a completely different saliva than men. More often, more acidic, depending on your cycle. And if you have menopause,
the same goes for vaginal secretion as well.
Yes.
I mean, men don't have vaginal secretion, but we are more acidic, right?
Exactly. And also in the mouth. So therefore, you're more prone to dental erosion and tooth decay if you don't manage it well. So the normal pH in the saliva is usually, there's only studies done on men, I think, back then. When the pH of men is usually around 7.4, but it's quite common, you can Google this and PubMed it, that female have more like 5.5. And we know below 5.5 is already attacking your enamel, which is the hard part of your tooth. So you just need to be making sure to get enough minerals and balance that out. And just chewing gum, xylitol gum helps there, for example, to just raise that saliva production.
Well, that's interesting because it happened. I didn't think it was a coincidence that it happened at the same time that I had entered menopause. Yeah, because I'd never had that before. But that's interesting. Of course, women it's always a little harder for us, isn't it?
Yeah. Some things are most of your things are harder. That's why women are just more strong than men. It's just a harder life for you. Yeah. And I mean, as you know, giving birth, all these things is just insane. No man can do it. I mean, I have 4 kids and my wife is she's 24/7 in her job, basically. Can't sleep. I would die if I have 2 nights no sleep. I could never do surgeries anymore. Yeah. She just manages it. I don't know how you women do that.
Yeah, you're like, you're like, I can't do that time. I'll be sleeping and there's no negotiating that.
Yeah, exactly.
Absolutely. Well, oh my God. So this has been so good. But I mean, I knew you were going to be fantastic guests because of your Instagram and the stuff I've been checking out. And I really appreciate your time so much. Is there anything else you want to tell us before we exit?
Maybe because of your hormonal group. So if you're optimizing everything already, but you're still having imbalances, even though you're on HRT or whatever, it's time to look into biological dentistry or look into chronic inflammation, chronic infections, like have these things on mind. Ask yourself 3 questions. Are there any metals in my mouth, or have I had them? Is there any root canal? Or did they remove my wisdom teeth? If any of these answers is a yes, there's room for improvement, because any chronic inflammation, any chronic infection will activate your fight and flight, which causes cortisol to go higher and adrenaline. And in the long run, is pregnenolone still causing your sexual hormones to change and your thyroid. So it's all intrinsically intertwined. And the mouth is the entrance to the system. It's kind of like the entrance hall to a hotel, and the hotel is your body.
Now, why with the wisdom teeth, you said?
Oh yeah, we didn't touch that. This is the third health killer, is if you had wisdom teeth removed, usually these areas don't really heal. Usually you're not prepared, you're in a depletion mode, you may be even only 15 years old, 16 in your teenage years, and your body is dealing with growth and has not enough nutrients, low vitamin D3, not prepared for surgery. And then you end up having chronic inflammation in your jawbone that no one tells you about, not even a dentist, because that's something you don't learn in university. This stuff is called cavitations in layman's term, chronic silent jawbone inflammation in the wisdom tooth area, harboring toxins, parasites, viruses, fungi, anaerobic bacteria, causing massive stress, being directly connected to the small intestine, heart meridian, adrenal glands. So think thyroid issues, autoimmune processes like Hashimoto's, think skin problems, eczema, acne, SIBO, all these things, and no one finds something. Maybe you had your wisdom teeth removed, having chronic inflammation, called cavitations, in medical terms, FDOJ, NICO stands for fatty degenerative osteonecrotic jawbone. Not taught in university at all. We have that included in our treatment protocols because it's such an amazing thing to heal people just by doing this. Sometimes they have all their problems resolved. It's insane.
Wow.
Like if you would, I had one patient this week. I will use this testimony in the future. She's 51 years old. I think menopause just finished, and she had massive migraine ever since she was 18 years old. I didn't even know. We just did the normal protocol, all metals out, all root canals out, all cavitations out. Now she comes back to finalizing her restorations after the implants are healed. So 4 months ago, we took it all out, and she told me, now I've never had any migraine again. And this is the fulfilling bit. If this is what patients tell me, they tell you have amazing teeth and everything, but they tell you my migraine is gone. My depression is gone. I'm healthy finally. Amazing job. And also gave me nice teeth. That's what it's all about in biodentistry 3.0. Like helping overall. Isn't it?
I mean, it is.
Fulfilling. Yeah.
I mean, why do they take them out anyway? I know when they're impacted and causing issues, but what's the alternative?
The problem is that for 80% of all people in the Western world, we grow too narrow. We could have a whole discussion about why that happens, but let's say it's basically a nutrient depletion, starting with breastfeeding or not breastfeeding. And then we just grow high and narrow and not wide anymore, causing us to mouth breathe, and then teeth collapse. We don't have space anymore. So we need braces, and there's no more space. So even the normal teeth have no space, no more space for any wisdom teeth. So naturally you have to take them out. But that is completely unnatural. This is super degenerative epigenetic issue. So imagine, the nature didn't design you to have no space for your teeth. Even Weston Price found that out like 100 years ago when he traveled to more endogenous people, that they all had perfect space for all 32 teeth. Never seen any dentist.
Real
no
wide
orthodontic.
jaws. Yeah, and beautiful.
Super wide jaws,
teeth.
super wide noses,
no toothbrushes.
No toothbrushes.
No crest.
No gum disease, nothing. And they didn't brush their teeth. Yeah.
Interesting. So then the wisdom teeth, so they're meant to be there. We're supposed to have them. Obviously, they're there, but our jaws are not wide enough. Okay.
Or too short.
Or too short.
Too small. Just too small. Just not wide enough, not long enough. So your lower jaw, like, look at this. This is the jawline. I have quite a big lower jaw, which is just normal, but my midface, for example, didn't really grow enough because of orthodontics too early in my career. So they just looked into making it nice, but they basically crippled my bite.
Yeah.
So we all had wider faces, and I mean, my nose is quite wide still, but yours is more narrow. So narrow noses Mid-phase didn't grow enough, and therefore you have too little space. But this starts in the womb. This starts with preparing women before conceiving, then with breastfeeding. Breastfeeding basically pulls the jaw forward and trains nose breathing. The initial orthodontic treatment is breastfeeding. And then you need the right nutrients to build that body. And if your body is in a depleted state and you eat all the processed foods and you have lots of inflammation in your gum and in your nose and in the tissues because of eating conventional dairy and sugar all the time, you just grow narrow, narrow, narrow. And then you have no space, gingivitis, mouth breathing. It's all just an adaptation. It's an epigenetic problem. It's nothing to do with our genes is not the issue. It's just epigenetics. We can reverse that completely.
Wow.
When we start young enough, obviously.
Amazing. You really are amazing. I'm so grateful.
Thank you. Thank you.
Incredible. I'm going to put this podcast at top five podcasts of all time in 9 years. I feel that strongly about this information. I feel that strongly about, taking care of your dental health. And, when I was born, I was quite sick, very sick. And as I, got a little older, when I started to, first of all, my baby teeth were just a mess. I was put on tetracycline, and I had spinal meningitis, I had pneumonia. I was so sick. And the medicines decalcified my teeth. And if there's such a thing, I think just weakened my teeth. I would get cavities all the time. I would, bite into an apple and my tooth would come out. Like, it was really, really traumatic as a kid. And just cavities. I had a couple of silver crowns on baby teeth. I mean, I looked like an orphan refugee. I was so sick. And I also remember having like terrible tastes in my mouth, and my gums were bleeding a lot as a kid, even when I started to get my big teeth. And I was always going to the dentist. I have this traumatic experience of going to army dentist when we were in the army as children. And I mean, I wasn't in the army. I was so young. It's one of my earliest memories. And they wouldn't let my mom into the exam room with me, which is insane. I think I was 2 or 3. And I guess I bit the dentist and I wouldn't let go. I did like a full blown like pit bull chomp down, would not release my bite. And I guess that, they brought me out to my mom, 5 minutes later and said, we can't work on her. And I had bruises on my cheeks because the dentist and the nurse were pinching my cheeks so I would unlock my jaw and release the dentist's thumb. Well, that's what he gets. They shouldn't have let me in there without my mom. They're crazy. And so for me, it was all very traumatic. And then when I got to the age where I understood, I got braces, and I started to just really obsess on dental health. And I just promised myself I would never, ever have a cavity. I would never lose a tooth. I would always just be obsessed. And I was for years and years. I even had, I had a tiny, tiny little pinhole cavity in a molar. Tiny, like she said, she wasn't even going to call it a cavity. And I begged her to drill out that tooth and put in a composite. I was already in my early 20s, I guess, late teens. And I begged her. I said, please fill that tooth. I don't want a cavity. So she did. I don't know how smart that was, but, anyway, needless to say, it's important. But I think I had such poor dental health as a youngster because I had such poor gut health. Incredibly bad gut health. And, I mentioned in the episode where Kiran Krishnan talks about all of that bacteria that we swallow, and it makes its way past our stomach acid if you have low stomach acid. And, they think that contributes to things like SIBO and other types of, inflamed, IBS and whatnot. So it's so important to really focus on gut health and also, keep your mouth clean. So I'm a big fan of oil pulling with castor oil, actually. And I just think this is the highest vibration oil you can pull with. And I think that matters. And yeah, so anyway, and I think that you should definitely check him out. He's got that book called It's All in Your Mouth, and that's easy enough to get online, super cheap. It might even be on Kindle. And then all his information is in the show notes. So if you would like to reach out to him and go spend some time in his fancy wellness center, gosh, I would love to do that. I mean, I don't have any dental issues right now, but I'd love to do it anyway. It just sounds like a spa. All right, well, that's it. So thank you for joining me, and I hope you enjoyed Dr. Dom. Dom is what I think that they call him, Dr. Dom. By the way, you should follow him on Instagram. He is Dr. Dome, D-O-M-E, 1, the number 1, Dr. Dome 1, and Dr. Dominik Nischwitz. A really good Instagram, too. So, yeah, I hope you enjoyed that. Thank you so much. See you soon.